Welcome. There's a lot of debate about when you should use ice versus heat, but the big question here is when you should not use heat. Well, that's very important because you can make the condition worse if you don't follow the right rules. You don't want to use heat on an acute injury. Whenever you have an acute injury, remember the mnemonic RICE, R-I-C-E, R, rest, I, ice, C, compression. You can use like an ACE bandage or something if you can, if it's an extremity. Obviously, you cannot do it if it's your trunk. And E, elevation. In other words, elevate the area above your heart. Most important thing is when you have swelling, you need to use ice. But do not put ice directly on the skin. You will burn it like frostbite. It will start to become numb and you will say, no, it doesn't hurt, but it will burn your skin like anything else. So put a paper towel between the ice pack and the skin so you do not burn it. Now, the question here is, what about like a Charlie horse, a cramping? Well, should I put ice on it? Because, well, if it's inflamed and it's swollen and it's red, yes, you could put ice on something. Obviously, if it's an injury. But if you put ice on just a cramped muscle, it can make it worse because ice makes it contract and get smaller and it might cramp more. Generally, heat is good, but I like moist heat. Moist heat, you could buy moist heating pads, although heat is still fine. The most important thing is use ice in the acute phase the first 24 to 48 hours. I like to use ice about every 20 to 30 minutes initially, maybe for the first several hours, and then you can start diminishing it maybe every couple of hours. 15-20 minutes per application. When it comes to heat, about 20-25 minutes per application. You can use it a couple times a day, but remember, do not go to bed with a hot heating pad because you can wake up crisp. I hope that answers many of your questions. Leave your comments below. Share this video with others. I ask you to subscribe if you haven't so you can continue to receive the best of the self-help videos here on the internet. And most important, make it a great day. I'm Dr. Alan Mandell.